Well, hello, welcome to the show,
Hi,
Dr.
thanks for
Haver,
having
aka
me.
Mary Claire. So good to have you.
I'm so happy to be here.
Um, should we just get to business? I feel like this is a
Let's
very business oriented podcast. Like we have a lot to go over, lots of uncomfortable topics to talk about. My favorite kind. But talk to me about how you got into women hormone, figuring all this out. Like what
Sure.
happened?
So I went through traditional medical school and very traditional OBGYN training.
Mhm.
Super proud of both. Loved my training. Like I got out of, 4 years of school and then 4 years of residency. A boss. I could deliver babies with my eyes shut. I was a great surgeon. I was, loved doing adolescent care, great at counseling teenagers, my just all that. And my patients initially, when I got out of practice in general, not all, were about my age. And
Mhm.
we kind of had kids together and then we grew older together. And so, as my population of patients was aging, I realized there were certain gaps in my knowledge that were not covered in enough detail in my training because I was getting caught like a deer in the headlights.
Mm.
One was issues with their sexual function, and we received zero training, zero
Right. Right.
in my training program. And I was scrambling. I remember running out and I was working. It was like my first 3 years of practice. I worked in a big OB-GYN office with like 12 docs. Okay. And I run out to the head guy, really nice man. And I said, hey, all these patients are complaining of decreased libido, da da da. And he's like, honey, he called me honey.
Right.
Um,
Already,
this
already
is
a
Texas.
flag on the
This
story.
is Texas. No, just the societal,
Of course, of
he meant
course.
well. He meant well. I didn't take it wrongly, but that was not okay, probably. And, tapped me on my shoulder, patted me like, just tell her to have some wine and relax. And I was like,
Mhm.
okay, so then I started my own reading and I started reading, anything I can get my hands on. And it was all like Venus and Mars books and stuff.
Right.
The old Masters and Johnson, which was more about how to have an orgasm than a woman's fulfillment and how she felt about, sex. And so, I just started cobbling together information to hand out to my patients. I literally was Xeroxing little books. Then they started complaining of weight gain, unexplained weight gain. And so I would just tell them, work out more, eat less. That
Right.
was the mantra, medical school and residency. The onus was on the patient to maintain her weight. We did not, or we're not at, now it's changing, but at that time, there was no like obesity medicine specialist or no one who studied the pathophysiology, the psychology, the environmental aspects of all this. It's basically you're lazy, you're not working hard enough. You just need to put down the chips. And so as like the majority of my patients who are now getting to be my age are complaining, I'm starting to scratch my head. I mean, these are women I work out with. These are women I hang out with. These, well, I live in a small town. And researchers I spend day in day out with. I know their habits. I know what they're doing and
Right.
they were gaining weight mostly in their midsection. So then it happens to me
Wait,
and
are we
I
allowed to ask how old you are at this time,
so
just for those
Yeah.
actively listening,
So
trying to relate?
right now I'm 54 going on 55. And back then this was 2017, 2018.
Okay.
So I am, 2016 is kind of when the light bulbs started going off.
Mm.
So, I was in my mid to late 40s. And so what happened for me personally was I had this kind of perfect storm of my brother who had been battling end stage liver failure, got really, really ill, had a stroke, and then died like 3 days later,
Oh, I'm so
and,
sorry.
I had decided shortly before that to get off. I had been treated for polycystic ovarian syndrome with hormone therapy,
Mm.
and so in the form of a birth control pill, and I had done well on that for years, years, but we said, "We're getting to late 40s, let's get off
Yeah.
and see how we do." And so I'm in full menopause, okay? Like, I get off and my ovaries had shut down at some point in the past, we had no idea when,
Wow.
and so I'm grieving my brother and I'm going through menopause, but was in no state of mind to tease out how much of this is grief, how much of this is really menopause. I could barely function. So I was
Wow.
getting home from work and just like roboting myself through work, trying not to let anyone die,
Right.
and would have nothing left for my family. I would stand in the pantry and just stuff my face with processed carbohydrates. That's how I was grieving.
Yeah.
And then I would swallow a big glass of wine. I'd basically shoot it and then go out and try to be a mom, and God bless my kids for surviving that era of my life, and my husband for picking up the slack. And so after a few months of that, the grief started to lift. And then I realized, oops, I've gained 20 pounds maybe. And scrubs weren't fitting, felt crappy, wasn't sleeping. And then I start going, this is menopause. I haven't had it. When's the last time my period? So then I'm like, oh, I'm in menopause. So I go and have the blood work done. Yes, you're fully menopause. Okay, now let's talk about treatment. So at the same time, I'm like, all right, work out more, eat less. I'm giving myself the same advice. So I am working out twice a day. I am calorie restricting. I set my thing to 1,500. That didn't work. Then 1,400. That didn't work. Then 13. I kept going down. I got down to, I'm embarrassed to say, I got down to about 900 calories because it had to work.
Right. No, because it had to be less.
Law of thermodynamics. It has to work. And so, I would lose a pound or two, but the minute I stopped, it would just come right back on. Now, the food I was eating was not very nutritious. It was low cal, low fat, low whatever, I was just
like real diet food.
Yeah. So I didn't know that I was just filling my body with junk, even though it was low cal, and, struggle. So my husband said he was going on a trip, and I said something to him like, when you get back, it's going to work this time. You're going to have the wife you deserve. And he just whipped around and he goes, baby, I have the wife I deserve. I love you. I don't care what shape you are. I think you're beautiful, but this is bothering you. I mean, I was getting up in the middle of the night to go to the bathroom, menopause, and I would weigh myself.
Wow.
Like at 2 a.m. just to see.
Wow. Yeah, no, I get it. Diet addiction is its own, right?
So I was in this really bad, hamster wheel. And so then I was like, okay, something's not right. Something's not working. So I, being type A, crazy, my OCD kicked in, and I started hammer texting and calling all the PhD nutritionists at the university I was working at, because I delivered all their babies and we were friendly. And I was like, what's happening with us in menopause? Like, I'm doing it, all my patients, nothing's working. And they're like, the department where I worked had a huge research focus on the elderly. So I had to they were throwing articles at me on the aging and inflammation and how it's going. So I had to kind of extrapolate between what the OB-GYNs were saying with inflammation and estrogen, and then the nutritionists were saying, and start making some connections. So I went down this anti-inflammatory rabbit hole, and it turns out most of what you can do is nutrition, really focusing on nutrition. I'd never, I knew it was kind of like porn,
to decrease inflammation.
Decrease inflammation.
Yeah.
And, I had told patients for years, just eat healthy, where I had no idea what that really meant.
Okay? Yeah, totally.
And so, it was like porn, when you see it. And, I just totally went with what packages said and what popular culture said was healthy, and dismissed other things as fads. And then I decided, because I was so passionate about this and I wanted to learn more, I enrolled in the culinary medicine program at Tulane University. And so he had been a guest speaker at like our AOA. It's like an honor society for medicine. I was a faculty, and I was so fascinated by this man. I ran up to him. I'm like, can I sign up? He said, sure. We offer it for physicians, physician assistants, pharmacists, nurse practitioners. It's a really nice way for someone who's well advanced in their medical career to get some good medical nutrition training. So I did that for 18 months, and it just changed my life, everything I learned there. So when I started kind of formulating the program, I wanted an anti-inflammatory principle, kind of like Mediterranean diet. We're very, very similar in that realm of, it's a pattern of eating. So I didn't think twice about the word diet, because in medicine, diet is a pattern of eating. It's not.
Did you read my mind? Literally, I was like, am I going to be able to be friendly enough with her to ask why she would call something the diet?
So it was for my patients. It was a medical prescription, basically, for my patients, as a new pattern of eating, a new way to think about nutrition. I thought nothing of it. Little did I know 5 years later, it's going to be a book. It's millions of people on the internet, and then all of a sudden people immediately dismiss it. We have hit national bestseller lists, but so my publicist is fighting to get us on these shows. I don't know, these morning talk shows. I don't watch it on TV, but I do.
I watch enough for both of us, Mary.
So they're like, no, the word diet's in it. No.
I can't imagine. I wish we could call, because it's a wonder. Honestly, I read it cover to cover. the Galveston prescription or something. I know.
Yeah.
I'm so this is just an antiquated word you were using.
I mean, in medicine today, we still are talking about where her diet consists of,
Right. In a chart note, of
vegetables, da 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 da
course.
da 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 da.
Yeah.
And so when I was naming it, it was just like I didn't have any name. It was just like, here, try my plan.
Right.
And and then I had to come up with a name and trademark and all that. So we're kind of stuck. But so that's kind of a very
Well,
long answer.
I have you on my show and I'm the anti-diet warrior. So,
I
and
am
but I
too,
have to
and here
say,
I am sitting
I
here with a
can't
diet.
imagine what that must be like for you. Cause even when I got the book, I was like, I have it right here, friend. I was like, am I going to open this? It's against all of my principles. And it's so good in there.
Thank
It's like it's all very, I mean, it's very good, but gosh,
if
what
you
a
can get over the
dilemma.
name,
What a dilemma.
there's more than a book than its cover, but we're kind of stuck. So,
But you know
what
what? You're stuck for such a good reason. Let's talk it out. You know what I mean? You're stuck because a long time ago you named it this and you didn't want to change the name.
as a medical principal, well, I didn't know it would be this big or get sucked into toxic diet culture. I just was trying to help my patients, and then they were telling their friends, and then I took it to the internet and it went crazy. And
Right.
you know, and so I was thinking more like Mediterranean diet. No one poops on that name,
Well, we
like
all want to be there. So there's
yeah,
that,
well, of course. And so, and I named it after the place I've called home for 20 something years,
Yeah.
raised my kids.
Wait, talk me through the big burst of the Galveston. Like what happens? Like we can't change the name because
Okay.
it's so
This
awesome.
is
Like
such a good
talk me through
story.
this.
So it's this little local phenomenon. My
Right. In
patients were telling
Galveston, Texas.
my girlfriends are telling it, and it literally was Xerox copies from the Office Depot 2 blocks from my house
And
right now.
generally, like, what are you telling people on your little, like, what's the little, we don't have to give it all away, but like, what are the little
Okay,
Xerox
so
copies?
it's an anti-inflammatory nutrition program. There's 3 kind of tenets or actions in it, and they're all meant to lower inflammation. Okay. One is intermittent fasting. Now, that may look different for different people. If it triggers hypoglycemia or an eating disorder, absolutely, it's not for you, but you don't have to do it. But it really can be a power, and I go through the science of this in the
Yeah, you
articles and
really
the
do.
research. It really can be a powerful tool for lowering inflammation. Not that great for weight loss. And
Mm.
another thing I talk about in the book is like the number on the scale does not measure your health.
Mm.
Okay. You are more than that number. You don't, that number's not telling you how much muscle you have, where the visceral fat is. If you just have like beautiful, juicy hips,
That's
and
right.
that's not unhealthy, so it doesn't measure your health, and a BMI certainly doesn't measure your health. So we're trying to look at things like non-scale benefits.
Mm.
So intermittent fasting is one thing I ask people to try, consider, give yourself 6 weeks to become fasting adapted. Just give it a whirl.
And
The
when you say
second
intermittent fasting, are you
so
saying like
I
a
teach,
12,
I
12?
kind of
Like, what are we saying?
I do a 16-8 is
Okay.
kind of my goal.
So
Now,
she's saying
other
she doesn't
students
eat for
do a
six.
12.
Yeah. For those who
Go
are
ahead.
like new to the party, like she's saying
Sure.
she doesn't eat for 16 hours. She only eats in an 8-hour window.
Right. And is it perfect every day? No. Like
No.
tonight, I have a soft opening. My girlfriend's opening a restaurant. I'm eating late,
Yeah.
whatever. It's fine. You do
Moving
your
it to
best.
10, moving it to 11. Yeah. Just
You move on.
conceptually.
So that was the first tenet. The second part is moving into education around anti-inflammatory nutrition.
Mhm.
So, trying to dispel some of the myths, the debunking, the fruits and vegetables, legumes, whole grains, why they're so good for you, breaking down the science of why each of those, how they work in your body, what they do for you, and
Yeah.
then talking about some of the things we know are pro-inflammatory, some of the nitrates and nitrite compounds, how we cure meats
Yeah.
it's a carcinogen, bacon, the way if it's uncured, it's probably better. We talk about artificial colors, flavors, trying to limit those as much as possible because they can disrupt the gut
It's just so
microbiome.
bonkers. It's all of these processed foods. I mean, I just had someone talking about gut health. It's like, it's like the advice that we're giving right now. Everyone's like, it's so confusing. Like, to be honest, it isn't like literally because this like and just walk us through because I like to keep it pretty third grade. Like,
Mhm.
why is it bad to be inflamed?
Oh, well, that's a great question.
Thank you.
So inflammation, there are 2 types of inflammation in our body, right? So we have acute inflammation, which we all know about. That is when you step on a nail, twist your ankle,
Mhm.
get a virus, have throwing up, vomiting. You know, acute inflammation is your body's way of ridding yourself of a toxin quickly. Okay. So if you have an infection, it's, white blood cells rush to the scene and they surround the antigen and they, make pus, which is, just white blood cells there fighting, like they're cytokines to kill the virus or the bug or whatever you got. If you injure and like a orthopedic injury, again, blood rushes to the area, it gets red, it gets swollen, your tissue starts, knitting back together and all the things happen. That's acute inflammation and we need it to survive. Chronic inflammation is a very low grade version of that, this inflammatory process where you've got an activation of red cells, white cells, things that should be off fighting bigger things are turned on at low levels and just start chipping away at your organ systems, chipping away at your immune system, chipping away at your heart health, chipping away at your kidney health, chipping away. And so chronic inflammation is linked to 7 of the top 10 causes of disease. Aging is one cause, and we all age. We can't get out of it, right? Nutritional choices are another. So when you've kind of gotten away with stuff when you were younger, and that's where my patients come in frustrated, like, I haven't changed anything. And in my mind, I'm thinking, well, you got away because you were 25,
I've been on a diet since I'm 7. So I'm very good with what we're talking about here.
So, and
that's so true. CC, my best friend, Lauren.
Later on, as women, we have endocrine aging. We are the only, our gender is the only one. Our ovaries are the first organ to age in our bodies.
Wow.
And they age to the point of absolute dysfunction to where they're no longer, what else? If your heart did that, you would die. Nothing else in our body self-destructs like that. Like
that's fascinating.
And so turns out estrogen and progesterone are very powerful anti-inflammatory hormones and work to keep us homeostatic. And when you take those away, inflammation levels go boom. So we see
my goodness.
immune disease increase, heart disease increase. So if you take identical twins, they are absolutely identical. And at 45, so they were naturally.
I'm 45. This is going to be a very painful study. Okay, let me take a sip of water first.
So you take 2 identical twins and you surgically castrate one of them at 45. And the other one goes through menopause naturally at 55. They both would have gone at 55. Okay. So the only thing different is you have removed estrogen, progesterone, and whatever percentage of testosterone she was going to make from her ovaries. The one who was surgically castrated has a dramatically higher risk of stroke, cardiovascular disease, osteoporosis, I said cardiovascular, cancer, quality of life being poor, her genital urinary symptoms, meaning vaginal dryness, painful intercourse, recurrent UTIs, bladder falling, dropping, all of it is much, 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 much higher.
And it's all because of the ovary. Wow.
Yeah. Lack of estrogen.
I think that's all. And so that's why there's so much inflammation, because we don't have the estrogen, progesterone, et cetera, working at the levels it did.
Like it used to.
Right. And probably maybe our intake isn't so great, or we think, oh, it's no big deal to eat this. Oh, it's no big deal to do that. Right.
You got away with it before. So the third tenet, the third action in Galveston Diet is what we call fuel refocusing. I didn't know what the hell to call it. Basically,
I like it.
Anything about macro and micronutrients. And my mind explodes. I read every single day. I go to PubMed every day and I pick a top. We're writing a new book.
That's why you don't watch television, Mary. That's like, I'm here for that.
I'm like, always like, I'll try because everyone's talking about a show. And then I'm like, someone will say something on the show. I'm like, oh, is that linked to menopause? And I'll start.
Yeah, you're just literally PubMed. I'll watch television for both of us. And like you do PubMed, and then we'll like have a meeting and I'll tell you nothing important.
So and I do a lot of education in the book. And so we started as an online program. So there was no book. So in 2018, we launched the program online through a little like online course called teachable.com. And they were great. It was great for a little startup, and so I'd had all these people who'd follow me on social media, and I'd been teaching the program to little groups for free. And it was great because I did that for about a year, and I did it probably for about 1,500 people. And they were giving me so much feedback. Explain this more. You went too detailed here. Here's some recipes. Here's, so it really helped me tweak and perfect how to teach the program, getting all that feedback. And then I took everything I'd learned and dumped it into an online course. And that's when it exploded.
That's amazing.
So before the book, we had about 100,000 students enrolled in the online program.
Wow.
All from just word of mouth and social media.
And then you just felt you had to write a book after that.
I didn't. They came to me. So I get this LinkedIn message from some editor and I had to Google her to make sure she was legit. And I was like, oh my God, this is real. Yeah, I was doing pap smears 5 years ago.
Right.
And so I'm like, oh my God, well, let me talk to her. And because it was Random House, like
Right.
legit.
Right.
And so she's like, oh my God, I'm such a fan. Da, 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 da.
Oh,
Have you thought
wow.
about writing a book? And I was like, well, I have a really successful online program. I'm worried a book would take away from
Mm.
my program sales. She said, so, we went back and forth. She helped me find an agent. My agent, Heather, has been amazing. And Heather has just held my hand through this whole process. And, she was like, think of it as advertising. Think of it as just spreading your message.
No,
People still
yeah.
like books, and the publisher does a lot of the heavy lifting with PR and all this stuff. And I was like, okay. So January 10th, it's like a year and a half process to go
Yeah.
from idea to
Oh,
publication.
yeah. I did that.
So,
Yep.
so the best news I have is I have a contract for the second book, which is
Oh,
like more about medical menopause. So for me on social
ooh,
media,
that's so exciting. Count
yeah.
me in on that one too.
So what started out as a conversation about nutrition and menopause exploded into just general menopause treatment options, just
Yeah. Well, it's
all
so
day
not,
long.
this is the thing, and I'm really glad that like Gwyneth Paltrow's going through menopause, like finally we're just going to talk about it in such a different way.
Mhm.
But can I just say on an aside, your story is such a story of following your passion and not being in the results business, just saying, oh, okay, I'm really passionate about this thing. I'm just going to go do it. And I think so often people are driven by, well, I need to have a best-selling book, or I need to have this many followers, or I need it to look this way. I need to make this much money. And you're just kind of like, well,
Throw
I,
spaghetti at the wall and see what sticks.
yeah, it's really beautiful.
I lead with service. This is what I tell my team. So now I'm like so proud that I support probably 20 women, like
Hmm.
who help me run this little baby empire, we call it.
Yeah.
And that, I always lead with service.
Yeah.
If no one bought another supplement for me or bought the book or bought the program, I will still die a happy woman because I know I've helped so many women at
That's
least
beautiful.
advocate for themselves, how to talk to their doctors, what options are available to them. You don't have to suffer.
Mm, I love
Nutrition
that.
has got to be an important part of your menopause journey in order for you to get your best health.
Well, can we talk about that for a second? I want to go back
Uh-huh.
to inflammation because I'm
Sure.
obsessed with it personally. And I think gut health is now like so big on the list. And then like inflammation's kind of losing its seat at the table. And it's so important. So I totally am understanding this part about like, okay, so the ovaries are slowing down, inflammation rises. So what are the ways that we can help ourselves to not be so inflamed in our body? And how do you know if your body's inflamed? Like other
Well,
than
chronic
stepping it out?
inflammation can fly. It's like hypertension.
Hmm.
You don't know, you don't walk around knowing you have hypertension,
Right.
unless it's really high and then you get a headache or dizzy or something. But chronic inflammation is why it's a silent killer. You really feel, so you can't put your finger on it. You don't feel great.
Right.
Something ain't right. Like
Yeah, I really
things are
do.
hurting a little bit more. You get up and goes kind of gone. And you're just, something's not right. It's hard to measure.
Is it the kind of thing like if I go to my checkup, they're not like measuring my
Well, here's the
inflammation?
problem. There are some tests that are like C-reactive protein is one. There's like 3 or 4 tests that you can check just for general chronic inflammation. The
Hmm.
problem is they don't tell you why. And so
Mm.
those are tests that I run routinely for my patients in my clinic. And then, something will come back, C-reactive protein will come back elevated. And I can say, look, this is up. We don't know exactly why. And it might just be chronic inflammation. Nutrition can go a long way here. Let's get our nutritional, plan in
Yeah.
place and let's recheck this number in 3 months. And if it's
Mm.
still elevated, then we'll have to do some more investigation. Is there a certain organ system that's causing this rather than
Amazing.
just generalized?
Okay, I want to ask a few like harder questions.
Uh-huh.
I read this book. I love this book. I don't know if you know this, but I haven't had sugar or flour in like 13 years. I'm like an easy person to talk to about this. But people listening are not. I'm like reading this. I'm like, oh, good. This is what I do. I'm so happy about that. But again, like I don't eat sugar and flour, not because I was like, oh my God, like
One of the
my,
top causes of inflammation.
yeah. Oh, well, I'm very excited about that. But the reason I quit sugar and flour is because I was like a food addict and couldn't stop eating. And then I
Right.
stopped eating sugar and flour and I was like, oh my God, it's like seeing color and I've been seeing black and white my whole life. But there's a lot that you talk about in a way that like don't eat in this book and about like the carbs, things like that. I want to talk through that. And I want to talk to the person who's like, don't tell me to stop eating carbohydrates. Right. And then like, where do we lean into? Oh yeah.
Right.
Okay. I like that. I
So
liked your face. Start there.
yeah, no. So we talk a lot in the book about, stratifying carbohydrates and what types that there are out
Yes.
there. And so fruits are carbohydrates, vegetables are carbohydrates, they have carbohydrates in them as a part of their makeup, but they're also packaged with fiber and anthocyanins and, powerful anti-inflammatory components. And so there's a big difference between, eating an apple and drinking apple juice.
Yeah. But I think even
And
in the book, what I found, I found astounding just because I haven't read a book like this in so long, is that it's not a diet culture book, but it's sort of a diet culture book because you're really talking about net carbs, like just things I haven't seen for so long, like since I read a diet book in the 80s or 90s.
well,
I'm
because
just super curious
because
about, listen, and I like live for someone who's true to their message, like count me in 1,000% on that. But talk me through like, yeah, of
I
course
had
there's a
to
difference.
give I had to give parameters. And so that was the tough part. I knew that calorie counting had not worked for me, had not worked for, the majority of my patients, just strict calorie counting because they were missing out on nutrients.
Hmm.
But I felt like I needed to give some parameters. And the meal plans are set between 1350 to 1500 calories a day, depending on the day, but
Do you think that across the board is enough calories for people?
well, it depends. We talk a little bit about, in our coaching groups and stuff, we talk a lot about, online, if you're running every day or you're exercising, we're going to have to add in, you're going to have to add in more. But, in general, we don't want you counting calories. We want you to eat till you're full.
Right.
We want you to eat almost intuitively. But, when we first started the program, there were no meal plans. This was
Mm.
just science. Here's kind of a backbone of things to, work on to avoid. But then, you get bigger and be like, I want a meal plan. I want,
Yeah, of
so then
course. Tell me what to eat. That's
we
like the
hired
only
like
thing people
women
say to
who
me.
were like registered dietitians, but also chefs who had gone to
Mm.
cooking school and had them create our meal plans. And I
Right.
had to give them,
Some param
certification.
but I
So
think
we were,
just there's one part of the book I remember reading, like a 10% carbohydrate intake. And my eating disorder's been in remission a long time, but boy, did it get tickled by that. Like, I was like, what? I want all the carbohydrates now. She just told me 10%
10%.
carbohydrates.
Yeah. So that's a rule of thumb. And you can go, you need carbohydrates to survive. And so, but we're like plus or minus 10% on across the board. But
Right.
we're going, especially with the sugar addiction, like you said, you
Right.
just went cold turkey, and that's what
I
the
did.
cure was. We are trying to bring the carbohydrate level down by taking out the simple carbs, the
Mhm.
processed carbs, and the carbs that you are eating are like fresh berries, legumes, veggies, filling your, whole grains, filling your body full of that.
Yeah.
And then once the weight loss comes off, once the fat starts coming off, then we,
Or no, then you move it up. I see that,
then we
right?
move
Then
it
you move
up.
it into like
So,
even 40%. So you're
mhm.
saying it's just, it's such a this whole thing is so tricky when you have diet culture and eating disorder culture infused in your mind, which most people listening to this are that, right? A lot of people listening to this have been on every single diet.
And
They only
we
hear what
have
the scale says, right? They're like,
we
they
have
want the meal
students.
plan, but they reject the meal plan. Like it's a tricky, and
It is tricky. So if I could, so for when we're talking, of course, we have students with different eating disorders, and they're like, okay, like I'm like, what are your triggers? What are your parameters? So it's like for some, they cannot intermittent fast. It just
right,
triggers all the bad stuff. I'm like, don't do it.
right.
You're fasting when you sleep. That's good enough.
Yeah.
You probably have a couple hours before you go to bed. You're not eating. You wake up,
Yeah.
drink
And
some
I think
water,
I don't think there's anything
whatever.
wrong, honestly. It's just I think even like a 12-12 is healthy for your body, right? Just taking 12
So
hours
the
to give your
magic
body a
starts at
sweet
12. The
break,
magic starts
right?
at 12. And
Right.
then
Exactly.
after 16, it seems like for some, you'll start burning muscle for protein.
Oh, that's
So, and you got to
interesting.
be really careful to make sure you're getting enough nutrition and calories in
Hmm.
your eating window. And then the third thing, if the percentages are triggering you, don't worry about it. Just follow the anti-inflammatory nutrition and see how that works. I mean, one of the
love
most
that.
successful things I've ever done was, we call it the Fab Four Challenge. It's the biggest TikTok video I've ever had. It's had tens of millions of views. And basically I'm like, look, stop counting calories, go get a nutrition tracker. We're not counting calories. We don't care about keto or any of that. We're just going to see how much fiber you're getting, how much magnesium you're getting, so I give 4 nutrients for them to follow. And then, on the website, they can go and I have lists of food that are rich and all these things, but using food. So just eat what you normally eat for a week and track these 4 nutrients.
What are the other 2? Are we allowed to ask, or do
Oh, yeah. Magnesium and omega-3.
Okay. So wait, fiber, magnesium, omega-3, and what's the other one?
Fiber, magnesium, omega-3, and vitamin D. Vitamin D. Yeah.
Wow. Okay.
And so just see with your normal diet, how close you're getting to the RDA, because the RDAs are loaded usually into most trackers, and it's recommended daily allowance, if y'all don't know what RDA is. And then the next 2 weeks, just pick foods that are rich in these nutrients and get it up to 100 and tell me how you feel.
Wow.
Nothing else.
We know what I'm doing.
Don't do anything. People are like, oh my God, this is amazing.
And you see the different, and like when you say people feel different when they focus on those macronutrients, like what do they feel? Like what's the difference?
They're fuller longer. They are getting a lot more fiber than they ever have. So they are satiated longer. Their insulin levels go down. Their cortisol levels go down. Like everything starts, that negative hamster wheel feedback cycle starts and turning the other way, just focusing on nutrition. And that's what I learned in my nutrition class. Like, you just can get the patient or the follower, the student, to look at nutrition as a way to, to fuel their body, and that what these, deficiencies in these micronutrients can do to you, and what make it, when you pick foods that are packed with these, they're also packed with other vitamins, minerals, and nutrients. So you end up, because of the 4 that I picked.
Right. That's brilliant. Right. It's not like you're picking like the keto peanut butter cups when you're doing that. Right.
No. So when you pick, you're also hitting your calcium, and you're also hitting multiple other of your goals, and your body's like, I'm liking this.
Yeah. Count me in. That's really.
So that's on our website. It's called the Fab Four Challenge. It's free. Anybody can do it.
And her website is in the show notes. So don't even stress. We have it right down there. You don't even have to go. You can continue to listen to our podcast. That is a really easy and simple way to do it. Can we talk about your next book a little bit?
Sure.
Can you tell me what do I want to know about it? I really think it's a wonderful thing.
So
no one's talking about. No one's talking about this.
I can't call it this, but it's almost like a what to expect when you're never going to expect again.
Why can't you call it that? That's so
because
good.
There would be a lawsuit from the what to expect people. So
I'm calling it that from now on.
It will be a menopause focused guide, and I'm going to cover everything. I'm going to cover, when I talk about menopause care in my clinic. So one of the greatest gifts I've ever given myself is leaving the hospital. I mean, I left 20 years of fantastic medicine, done and dusted, okay, ready to move on, so I could focus on menopause care. So I don't do surgery. I don't deliver babies.
What inspired you? Just because your patients were aging with you and you're like,
so here I am building these millions and millions on my platforms, and people are like, I want you to be my doctor. And I'm like, I'm a hospitalist. I'm delivering babies at 3 a.m. and, doing a TikTok at 4. And so I'm like, there's gotta be a better way. I can't keep up this pace of no sleep, and it's so disruptive, and I'm not staying healthy. And I really, people were just begging me, I want you just do menopause. And so I took all my girlfriends out to dinner one night, and we literally had a brainstorm on what this clinic would look like, how we would set it up, what would we offer, what would they, cost. And then I had my COO there, and she was just running the numbers on the back of the envelope, literally sitting at dinner in Galveston one night, and we developed the clinic. And it has
wait, do I need to come to Galveston and have you as my doctor?
I invested, so you will love this. Okay. I invested in an in-body scanner. So to measure muscle mass and fat and visceral fat, subcutaneous and visceral fat. And so I get to look at a patient who's been told she was obese or overweight her whole life and be like, you are a freaking boss. You have 120% muscle mass. I am so jealous because I have 85 with my little skinny genetics. And, I'm super high risk to fall and break at 70, and never get up again. And you are going to be like slugging grandkids, 3 of them on your back up the mountain, so like, to distill, I don't even look at BMI. So I have this powerful machine, and then I'm able to really tailor their nutrition
Mhm.
recommendations based on how much visceral fat they have, where's their muscle. I can, I'm not a physical therapist or I don't have a training and certification, but I can say, look, when you go to your trainer, you need to bring her this because it shows them exactly where their muscle mass is, how much they have, what percentile they end up in. Don't skip leg day. Your legs are falling way off the curve
Is
because you've
there
been
a
so
way to
skinny.
figure this out even in a general way if you can't get I just think about,
So there's for visceral fat, there's a reasonable way to do it. It's not perfect.
right, but
It's
we don't
called
have
the
to go to
waist.
Galveston, Texas and get in the
No.
machine, though I might. So
So
keep
I
the
think it's
doors
in the
open.
it's in the book. It's the waist hip ratio. So
Okay.
it's measuring the smallest part of your waist and the widest part of your hips, and you divide the two,
Mm,
waist over hip. And
okay.
so if you're less than 0.8 in a woman, you are probably do not have excessive visceral fat. If you're more than one, most likely you do.
Hmm. That's
So
so
it's just the
interesting.
back of the envelope quick, but it does kind of get you. And so that's one of the things we have our students track is their waist to ratio through the program rather than just
Like, love that you call your clients students, like, so here for it, may steal it and will use you as I think that's such a beautiful way to think about the people that you're working with, right? Because we also are the architects of our own recovery and our own, path to nutrition. I think that's like I've never heard that before. What made you think that?
Well, I just, but the students started when I couldn't, well, they weren't patients because I have to be really careful on social media
Oh,
about how
that's
I answer
funny.
questions and
It's like a CYA and it's so
what
beautiful.
advice I give
Yeah,
because
totally.
of malpractice.
Mhm.
And, everything has a disclaimer, I have to protect myself. And so, and the 100,000 people that enrolled in the program were my students just there to learn about nutrition from me.
Beautiful.
Now, when they come to my office, they are my patients and
Mm,
I'm able to prescribe hormone therapy if we agree it's a good thing for them.
right.
I'm able to, really give them like a meal plan just for them, a nutritional focus just for them. But so the book is more about what I call the menopause toolkit. And I want to take it system by system. If your menopause is migraines and back pain and, gastrointestinal disturbances, like here's the skinny on what we know. Like, here's what hormone therapy might help with. Here are other medications that might help. Here's over the counter stuff. Here's what supplements might do. What do we know about, workouts, like different
Right.
types. There's studies done. The first one I tackled was depression. And so looking at nutrition and depression and menopause, looking at, yoga has been shown to be helpful and, just helping
Right.
them build a toolkit for focused on them and their personal health. And so in general, the toolkit, when we were kids, did you ever have one of those little caboodles for your like makeup?
1,000%.
Yeah.
I want one right now that you said that, and
So
a trapper keeper while we're up,
we have trapper keeper in your caboodle.
Oh,
So you open up your caboodle and in it is your menopause care. So we're
I
like, okay,
love this.
everybody wants one thing, just a magical pill. And you take this thing, whoop,
Yeah.
off you
Tell me
go.
what to do. Right.
It's my
Mhm.
magnesium. And it's going to fix, that's not what, no, that's not a thing. And so first thing, the most important, the biggest box you've got is nutrition. And if you're not maximizing your nutrition, almost nothing's going to help you.
So
Like
when we're perimenopausal and menopausal, if we're not managing our nutrition, there's not
you're going to suffer. You're not
wow.
maximizing your health. You're going to
We're
suffer.
talking and mostly you're talking about an anti-inflammatory, of which
Right.
if you're in
Right.
my real elite crew, sugar flour, biggest offenders, right?
For a lot of
Grain
people,
flour. Yeah.
absolutely. Yeah, absolutely. So that's first and foremost. Number two is exercise. And we
Mm.
don't exercise to be skinny. I'm like, take that out of your mind. Do not go into the gym thinking I'm going to lose weight. Do not, you're just doing yourself a disservice. We go to the gym to be strong. We do resistance training consistently for strong bones and muscles,
Mm.
and we do cardio for a strong heart. Everything makes a strong brain.
Wow.
Okay. Because what scares people the most about aging? What about you? What scares you
Uh,
the most about getting old?
honestly, like aging poorly, like period.
Okay.
Like
So like
being in pain, being like just
incapacitated,
incapacitated.
right?
Yeah.
So I thought,
Optimal aging is like always my New Year's resolution. I'm really like the wrong person to ask that
so
question.
mine was cancer because my family
Oh,
history lost
interesting.
two brothers already
Uh-huh.
to cancer and my third,
Right.
and then, but like overwhelming that I won't be able to work, that I won't be able to move, that I won't be
Right.
able to think, that I'll have dementia and Alzheimer's
Yep.
and,
Me too. Me
Parkinson's and
too.
all these things. And they're like, I just want to be able to take care of myself and have a fulfilled life. And I was like, oh my God, that's what I need to focus my practice on,
Yep. Optimal health.
aging well, like
Yeah.
with the menopause focus. So
I actually am, though I'm loving like, this is the beautiful part of what's happening culturally right now is that we are changing the conversation about menopause in general into, how do I go into this next part of my life in a beautiful, optimal, loving way? It's
right.
fabulous.
So third in the toolbox is pharmacology. And so we're going to subdivide that box into hormones and non-hormones, and that's really dependent on your symptoms and what we're trying to treat and what we know it can do for your long-term health. How old are you when you get started? For hormone therapy, there's a definite window of opportunity to decrease your risk of Alzheimer's, dementia, and heart disease.
Mm,
You got to start young.
wow.
Starting in your late 50s, 60s, you're not going to get those benefits, though the hot flashes and stuff will get better. And then supplements, and I'm like, we don't swallow a handful of supplements and then go through the drug men make
Right.
poor
And go to
choices. I don't want
McDonald's.
to
Right.
demonize fast food. I like Whataburger chicken fingers. That's my, and
Yeah.
um, but I can't go through the drive-through and then swallow a handful of supplements and think I'm negating that
Right.
choice.
Yeah. Totally.
We supplement a healthy diet. And so we need to supplement sometimes because we have allergies or intolerances, or we don't have access to certain things. We don't have enough money to buy fresh salmon or whatever. So fish oil is something you probably should supplement. And so I do a lot of talk around what supplements we know help in menopause. And, I talk a lot about what I recommend to everyone. And then we do individual recommendations based on sleep, et cetera.
It's so
Stress
beautiful.
reduction. Then the next thing is stress reduction, whatever that looks like for you. For me, it's therapy
Yeah.
and meditation and journaling, but it
Yep.
may be prayer for others, yoga, a walk with a girlfriend, whatever.
Yeah, but what you're saying is so beautiful because it's not a luxury. Like, we're not saying these things are luxuries or even in this aspiration to have a perfect body. It's in a way that if you want to age optimally, like, this is how you have to do it.
I don't know an
By the way,
80-year
it's not that
old who
hard.
cares what she looks like in a bikini. So, like I want a happy grandma, happy,
Yeah,
that coastal
happy.
grandma look, who's killing it, who's happy. You can't wait to go see her. I want my grandkids to want to come. No, I don't have any yet. No pressure on my children. But like, I want to be that person who I'm fun and they want to come with me.
1,000%. Yeah, no, I love it. So
So,
how
and the
can we know
last
you
one, but let
better?
me finish. The last one is
Oh,
sleep. Sleep. We must
oh,
sleep.
wait. Can we start that sentence over? Because they're gonna have to cut that out. The last one is because yes.
Yeah. The last one in the toolbox is sleep.
Mm,
If you're not sleeping, nothing's going to work.
I
And so all of the tools in our toolkit will work synergistically to get you back to some semblance of where you want to be. The best thing I could ever do for a woman would be to take her 25-year-old ovaries out of her body and then put them back in at 50. But we don't do that. So
in lieu of that, we'll do
in
these
lieu of
five
that,
things.
hormone therapy will make you feel better, but it will never get you back to 25,
Yeah.
So we can't
Yeah.
ignore the nutrition, the exercise, the sleep, the stress reduction. All of it has to come into play.
And maybe there's a piece of stress reduction and even just leaning into the idea that we're never getting that 20. I think so much of the stress and overwhelm is about that we're like losing our youth, but like that's a normal part of the life cycle. Like go watch
Right.
Lion King,
Yeah.
It's like
Aging is
what's
normal, but suffering is not.
oh,
You
there's the quotable. Okay, so if we want to hang out with you, which I would like to hang out with you. Actually, I'm so excited for our next podcast when the next book comes out, but so excited. Where do we find you?
So on Instagram and TikTok, I
How great
am
is that?
Dr. Mary Claire. So DrMaryClare.
Mhm.
And then on YouTube and Facebook, it's the Galveston Diet, Mary Claire Haber. If you
Got it.
just Google me or go to our website, we
Yep.
have links to all the
All
things.
in and your website and your website, because I'm sure lots and lots of
GalvestonDiet.com.
people. Yay.
GalvestonDiet.com.
Amazing. And this book, we can buy it, even though it
Yeah,
says diet.
just
Ooh.
forgive me for the name.
The Galveston prescription. That's what I'm calling it.
Yeah.
But it's really, I mean, I did read it cover to cover. I think because it said diet on it, I was like, I'm not having this, I was like, and then I'm reading, and I'm like, oh, this is really good stuff. I'm
I
still
mean, I
gonna
had a follower tell me she absolutely loved it. She had it on the bedside, but she would flip it over because she was scared her daughters would see the word diet.
I know.
And she didn't want to give them a complex. And I was,
It's diet in the
oh,
clinical sense. It's
I
diet
was,
in the clinical. I know. I mean, I hear you. I watch 13-year-old goddaughters being so, it starts early. I mean, it starts early forever. But anyway, you're amazing. Thank you so much for coming on. I can't wait to know you more. Maybe come to get in your little machine soon. Thanks so much for coming on the show, Mary Claire.
All right.